Thanks.
Good morning and good afternoon, everybody. Welcome to Stimulus Connect 22, Safer Bathrooms. I am your moderator for today. My name is Denise Baldwin. I am coming from the territories of the Anishinaabeg, located in Ontario. A little bit about myself. I have a long history in harm reduction, largely focusing on Indigenous people who use drugs. I come from the nation of the Chippewas of Nawash, which is located in the beautiful Bruce Peninsula. And I am also coming from Barrie, Ontario. And so today I'm just really excited to be here and be part of this wonderful conversation and discussion, and really looking forward to seeing these presentations. And so I'm just going to hand it over to Shannon, who's going to do a welcoming.
Good morning, everyone. Thank you for showing up today. It's great to know that there's so many of you out there. So before we begin today, I just would like to acknowledge the Indigenous land that Kali and I are presenting from today. And I'm thankful to be living on the traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh First Nations. I always ground myself in the land acknowledgement as it relates to the work that I'm doing in the colonial healthcare system. Colonial practices have caused harm and continue to cause harm. And it is my work to continually be learning with curiosity and humility how I can do better and share what I learn with those around me. And I invite you to do the same. So if you do know whose land you're on, please write it in the chat. Knowing whose land we are on is one small step that uninvited settlers can make in the path to truth and reconciliation. And if you don't know whose land you are on, you can find out. One simple way is an app called Whose Land. And with that, I'll leave you to it. Thank you.
Thank you so much, Shannon. So before we start this conversation today with our amazing panelists, we have a few planning committee members who are helping out in the background and will give us a wave. And thanks in advance to the folks who are doing simultaneous interpreters. Nadja, Jen, and Shay will be in our tech folks. And thanks to Fanny and Danielle for interpreting for us today. A little bit of housekeeping rules. We are using the hashtag StimulusConnect. So if you are on Twitter, you can retweet and use that hashtag as well. We welcome questions and chat in either French or in English. Questions for panelists go in the Q&A, which is located at the bottom of your Zoom screen. You can also upvote them, and Nadja is going to translate them into translate in the chat. This event is being recorded and will be available on the Stimulus website in the future. If you're having problems with the sound going in and out, please turn off the oral interpretation when you do not need it. Stimulus Connect has 20 resources thus far, and if we identify more today, we will add those in. The website links will be also available in the chat. And so I'd just like to welcome and acknowledge that we have over 200 participants today. We have several library staff members from 4 provinces across Canada. We have 11 city staff from several different cities across Canada. We have 20 people from 10 different health regions. And today we have the most Americans we've had at a Stimulus Connect. We have 12 folks coming from 7 different states: Virginia, California, Kentucky, Ohio, DC, Oregon, and Maine. So welcome. And we also have at least 11 organizations run by and for people who use drugs represented here today, including friends from the Burundi Association of People Who Use Drugs. And so right now, I'd like to invite each panelist to introduce themselves, and we're going to go in the order of Paula, Callie, and then Shannon.
Good morning or good afternoon here in Winnipeg. I'm Paula Migliardi, coming from a cold and bright day here in Winnipeg. And I would like first to acknowledge that we are, or I am, in Treaty 1 territory on the original lands of the Anishinaabe, Cree, Oshie Cree, and Dene people, and of course the homeland of the Métis Nation. And I'm coming from, I work with a healthy sexuality and harm reduction team here at the Winnipeg Regional Health Authority. And my role is, I'm a program specialist, that's my position. And it's a fancy name to say that I'm a team member that provides support to our team in terms of evidence-based and evaluation, assessments, and all other support in program development in the area of harm reduction, as well as collaborate and support number of community organizations with harm reduction supply distribution issues. So thanks. Nice to be here.
Yeah, hi there. I'm Holly Sedgemore, and I come from Numbees First Nations, but I'm here in Vancouver right now, and I work with BCH as a peer harm reduction leader and doing education and trainings and stuff like that. But also run Coalition of Peers, Dismantling Drug War as a president, and I work a few other peer jobs in Vancouver. I do a variety of different things. And I'm excited about this, and thank you all for joining me.
All right, thanks, Paula and Callie. My name is Shannon Riley, and I'm an uninvited settler of Ukrainian and UK descent. My family first arrived in Treaty 6 territory, and have been living in many places since then. And my background is nursing. I've been nursing now for just over 20 years, and I've come to my way through to bathroom work through doing frontline work for just over 10 years in San Francisco in a drop-in center. And it was in this space that I was reacting a lot to overdoses in bathrooms. It was just like kind of doing this, doing the same thing in the spaces that are, that you're all dealing with today. And it wasn't until the passing of a friend in a bathroom where it allowed me to kind of jump in front of that and start asking more questions, like, why does this door swing in, and why do the doors continue to swing in? So that's how I'm here doing the work and presenting with you today. Thank you.
Thank you so much, everybody. Right now, I believe we're going to be launching a poll. Shay is going to launch our anonymous multiple choice 6-question poll. The poll is how Stimulus Connect can learn about who is in the room, so please answer those. Just a reminder that you can add questions to the Q&A tab whenever you like, as well as vote for the questions that you would like to be answered. So if we can take just a couple of seconds here and fill out the poll. Okay. Well, with that, we're going to revisit the answers to the poll a little bit later on in the presentation. So what I'd like to do first, oh, the poll has disappeared. I'm sure we can get that back up. There it is. It's back up. Okay, we're gonna get that poll figured out in a bit, and hopefully it'll come back up and start again. So I'd like to invite our first presentation with Paula.
Thanks. And to, yeah. Is that okay? Can you see that? Yeah. Okay, what I'm going to do today is to share our experience managing a safer washroom in our facility. So what I am going to do is to describe the operations of a safer washroom available at Street Connections, Healthy Sexuality Harm Reduction in Winnipeg, and to share some of the findings from what we have learned from operating this safer washroom. And but let me give you a bit of context for where this washroom is situated. This washroom is found in the facilities where Street Connections operates, and Street Connections is the largest distributor of harm reduction supplies in Winnipeg. So we distribute supplies out of a fixed site during the day, that is Monday to Friday, where this is where the safer washroom is found. And then we also provide harm reduction supplies out of a mobile service that's in the evenings 6 days a week. So and we, you may ask, why a safer washroom in this facility? First of all, we know that privacy and comfort are key characteristics of safer spaces of drug consumption. So these features are not easily found in public spaces. However, to some extent, public washrooms provide that privacy, and therefore they are a common space for drug use. And because we also know that people who use alone in these spaces are at greater risk for experiencing harms associated to drug toxicity, making these spaces safer is key. So with that in mind, safer washrooms, from our perspective, are promoted on the assumption that people are already using substances in public washrooms, and that we are ethically bound to enhance the safety features of these spaces. And further, we believe that a safer space will assist anyone facing any health emergency in those spaces. So it's commonsensical to do. With regards to why our own safe washroom, so what in the mid to late 2010s, there was an increase in opioid overdose events registered in Winnipeg. Although no data exists on the extent to which overdose or drug toxicity events were occurring in public washrooms, there was a fatality in the facility where Street Connection was operating at that time. And And therefore, this is what brought to the attention of the need to do something about the washroom. So and we for the is we don't have supervised consumption facilities in the WHO where to refer some folks. Is not uncommon that some of our clients will ask if they can use drugs in our facilities. So it was important that those features were enhanced, safety features were enhanced. Let me tell you what those features look like. We have a client activates a button to lock the door of that washroom. This is a single user accessible universal washroom that is found within the space of the harm reduction supply distribution program. And it can be observed from the front desk and outreach desks. It also is also adjacent to an open area where other people will be waiting for services. So because of that, that configuration, our approach is to have someone monitor the washroom. So again, one of the things that people will do will be to activate the washroom lock, which connects to a 10-minute timer that will begin at a time. At 10 minutes, a lighted signal activates, and that's when our staff will knock on the door gently to see if the person is okay, if they need more time, and if people need more time, when that's necessary, the timer is resetted. And we have as well just installed a mechanism for which we could lock or unlock the door remotely, so we don't need a key or to look for a key in case of an emergency. Just push a button to unlock the door. We have also an alarm button that could be activated by the client in case that the person needs some help. And what we do is to have a staff-oriented all the responses procedures, which drills carried out every 6 months or every so often. Plus, we have sharps containers, a wall-mounted sharp container, and we have found that about 75 to 100 sharps are collected every month. This is an indicator that people are using in our space, and again confirms the fact that we need to keep these safety features in mind. And we have found that there hadn't been any safety issues related to having needles in the washroom, and no plumbing issues noted since the installation of the safer washroom, which can be an issue for many who don't have these features installed in their washrooms. Plus, later on, we install a sturdy wall-mounted clean surface, like a shelving stainless steel countertop, which is just about waist height, to facilitate for people to put objects to facilitate drug preparation or other drug use practices in case that's required. So what we did to understand how the space was used and the perspective of people who use the washroom, we conducted in 2018 a formal evaluation of this intervention, and this resource is available among other resources that will be shared with this webinar. The overall objective was to understand the experiences and perspective of users, the bathroom users, and the program staff as well. However, as this space is not sanctioned for drug consumption, asking people to talk about their experiences or views was a bit complex. Still, we found a few people who will talk to us about those experiences. Also, a year later, a number of harm reductionists came together under a project intended to assess what safer consumption spaces look like from the perspective of people who use drugs in Winnipeg. And among those spaces assessed were washrooms. So the report, which is also linked here and will be shared with other resources, includes great insight that could inform the design and operation of safer washrooms, and has been good to check our own space on what people had said at that time. We also conduct ongoing monitoring of the space. So that means that we keep track of episodes where staff had to open the door, and what the drug-related incidents look like, and also keep tab on needles found in the sharp containers. As part of our reconnaissance or outcomes for this, for what we track, our monitoring process, is that we only had to respond to a few drug-related events since 2016, when this washroom was established. However, most of these events had occurred since the onset of the COVID-19 pandemic. So, we believe that this is not surprising considering the changes in the drug supply, resulting in increased drug toxicity, and also the fact that access to public washrooms had been severely limited, driving in increased need for making the washroom accessible. So we kept the space open, and people. There's more people using the space or the washroom. So what we also found, there hasn't been any fatalities or significant drug harms because of the use of that particular space. From the perspective of people who use the washroom, we found that overall program participants need accessible and private spaces for drug consumption, and of course that well-kept public washrooms are desirable. So that is clean, well-lit, spacious spaces. We also found that when discussing the safety features of the washroom, these were, from the perspective of participants, the right thing to do. They felt that it was important for them to know that they were cared for in this way. We also were concerned about the 10-minute limit and the fact that we were going to disrupt their activities in the bathroom with this protocol. So we asked about that, and for the most part, people said that they were not feel rushed. So 10 minutes was the amount of time. And they explained that for those who inject drugs, that there was a distinction between feel rush and doing this rapidly. People were very proficient in injecting the drugs, so that was important to learn. And we also, they also understood that there was an option for them to stay longer in the washroom when needed. So another thing that we learned that it was important to have spaces where to comfortably hang out when exiting the washroom. And sometimes people hang out, but most of the time people leave our facility anyway. From the staff perspective, and this is something that many of you will be interested to know, safer washroom were easy. This safer washroom, at least, was easy to manage. And however, there were some concerns noted with regards to the unusual lock button that is in the facility. This is not common, so people had to be reminded on how this works and why they needed to use that button to lock the door. And there were also concerns about the fact that there was when with regards to using substances in the facility, because this is not legally permitted. However, we know that, and there has always been evidence in our washroom that people will occasionally use the bathroom for preparing their substances or use substances. So sometimes it's hard to navigate that conversation in that context, especially in the context of criminalization and stigmatization for people who use drugs. So what has been helpful for us as well is that to have a person, to designate a person for orientation training and general oversight of the washroom as well. Just to conclude, a few remarks here is that access to washroom facilities is a human right, and the availability of a public washroom for clients or community members is a dignity that is congruent with the values that we uphold and with the principles of harm reduction. So we find that the safer washroom as a harm-related drug event intervention is acceptable, easy to manage, and cost-effective, and that the promotion of this intervention is key, even though this is just a small answer to a larger issue that this is not the this is the answer, not addressing the main issue that is the drug toxicity in the current drug supply. We also found that sometimes it doesn't need to be fancy, and that at least we need to start for having for everyone to adopt general principles of washroom monitoring, which is just checking on the facility, looking and checking up for people's safety. So yeah, so this is it. And here are some of the resources that I mentioned that we have available. Thank you.
Thank you so much, Paula. We do have a few questions that have come up in the Q&A section. I'm wondering if we should just hop right into that now. Sorry, just give me a second. Yeah, well, let's just get into a couple of them and then we'll get into the next presentation. So one of the questions that was presented is, are items such as needles and rubber bands provided to people that use this service?
Yes, because we are in a space where harm reduction supply distribution occurs. Most of the clients and people who use the washroom will have come to the facility looking for all type of harm reduction supplies. So it's fair to say that they will use the supplies that are being provided at that time.
One other question that we have here is, bathrooms can be a safe space to split drugs or do deals. Is this a possibility at your location or your bathroom?
Because we are not, this is not a legally sanctioned space, we do not know what people will do in their washrooms. I'm not completely sure the extent to which more than one person access the washroom at any time. But the washroom is fairly spacious, so it wouldn't be it could happen. It certainly could happen that people will come and this is a private space. We don't have any jurisdiction over what people do in the washroom. So precisely because of that, we need to make sure that the washroom is safe for everyone. And people can do whatever they need to do in the washroom.
How can this be adapted to spaces that are not harm reduction spaces? This is from and there's more to it, sorry. So I'm thinking of a library in a small town where there are a handful of people who use the washroom regularly to use drugs. The library is okay with this generally, but I think staff and management struggle with how to resolve issues that come up and how to set it up to be safer for everyone to begin with.
Right. From a washroom perspective, I think any of these features will work anywhere. For sure, our washroom has been monitored, so that means that we have the luxury of having people who have been trained in harm reduction and that work in this space that, for the most part, will have had relationships with many of the people who come in to use the space. So from a perspective, overall perspective, I think any of these the safety features per se of the space will work anywhere. And what's important for us is to do some of that orientation around principles of harm reduction and around managing stigma and any other issues that relate to the fact that people who use drugs use the space as anybody else. Yeah, I'm not sure if I'm asking the question per se, but I think those overall principles and philosophy needs to be put in place first, and to make sure the space is safe for everyone beyond the washroom itself, I think.
What has been the community's response to having a safe use space? And what has the police response to such a place? And have they ever been called to help with an incident?
The community is, as I mentioned, there is a good reception. People use the washroom, come to use the washroom. I think it's a safe space, it's a clean space, it's a quiet space. And in terms of the incidents that we have to respond to, we call 911. Luckily enough, they are around the corner from our building, so the response is quick from paramedics. But we haven't had to deal with police in those instances. So still, paramedics sometimes want to bring the person to hospital, and we try to make sure that this is up to the person who had the incident to decide if that's something that they want or not want. So yeah, but not directly with police.
Okay, thank you, Paula. So if Callie and Shannon are ready, I'll invite you to come start presenting.
All right, thanks, Paula. Thanks, Denise. All right. Okay, so this is our presentation, Safer Bathrooms, and we will be presenting a toolkit for overdose response and harm reduction. But first, we wanted to start with a few questions. And so for those of you who have not done a Menti before, it's pretty exciting. So just if you are on your phones or computers, you can go to www.menti.com and put in this code. Let's see, I have a little code, which is 28556286. Maybe we could put that in the chat as well. And you can see this question: what are some reasons people use drugs in bathrooms? Just, I know we know things individually and organizationally, but it will be nice for all of us to see this slide populated with some of the reasons that so that we can all do some quick learning here at the beginning of this presentation. And we'll see the words that, or the thoughts that are common will show up bigger. Kali, what do you think about these?
Interesting. Yeah. They're all very true.
Yeah, like there's no other options available, right? It's just like we need safe bathrooms. That is absolutely true. And also like this can't be the only option, right? This is one of the suite of options, right?
Privacy is really making a
Privacy.
It's really true.
Yeah. Convenience. Yeah, they're ideally they're all over the place. We didn't see that with COVID though.
No, definitely not.
Yeah. Warm and dry. Yeah, out of the elements. Yeah, we don't have the cold in BC as in Saskatchewan and the prairie provinces, but sometimes that's people's only warm space for sure. Thank you, everyone. These will be shared to these slides will be shared so you can show them to your colleagues what are the ideas that came through. I'll just give it 10 more seconds here, and then we're going to skip to the next word cloud so we can get on with the information we have to share. Okay, so the next word cloud. What are some of the ways you might know if someone was using drugs in your agency's bathroom? Aha, waste. I figured that one out. Waste, yes, things. Yeah.
It's funny that someone said a long time, taking a long time. That's sometimes
What's that, Kali?
It's funny that someone said taking a long time. So I'm like, actually, someone gets to be in there using the washroom, actually not, and that's why they're taking forever.
Yeah, right. There's so many reasons why someone could be taking a long time in the bathroom. One of them is drug use. Yeah. Let's see. But yeah, lots of things left behind. Sometimes someone might tell you. Splashback. Yeah, definitely. This is something. Yeah, blood on the door. I'm not seeing clogged toilets here.
Yeah, I'm not either.
Right, but that's a big one, right? Sharps containers need to be as close to the toilet as possible because we want to reduce clogged toilets. The closest line of for that hand to get into the sharp, the waste to get into the sharps container will prevent those clogged toilets. All right, thanks everyone for participating in this. I'll just give you about 5 more seconds. But we can see the ones that really people see a lot is the things that are left behind in blood, and you know, we're focusing a lot on injection here too, right?
Yeah, and then also the taking a long time. I'm coming back to that 'cause it's just like opiates do make you really constipated, so you can be in there for a long time because of that.
Yeah, medical opiates. Yeah, anybody. But also people can be smoking, right? So I don't see anybody. Yeah, actually there is some smoke coming from the door. Yeah, there's one there. So smoking. Okay. Okay, I'm gonna jump along here so we can start sharing with you some of the things that we've learned. So this is what we want to do together today. Colleen and I are going to share our history with safer bathrooms in Vancouver and the history of our project. We're going to do a little bit more trivia, which is just fun to see what you know, so we can talk to that, and then we will show you some screen grabs from the bathroom safety toolkit that we did together this year. So some bathroom safety history. Just wanted to start with when I moved to Vancouver in about 2015, the Vancouver Coastal Health was doing a redesign, and they came out with this policy document in 2016 on washroom design and monitoring, which I think was a good start. I mean, it was acknowledging that drug use was happening in bathrooms. They were acknowledging that we needed things like trauma-informed care and shelves, like Paula pointed out, like different amenities that bathrooms needed. And so it was just a list of recommendations, but it was a good way to at least get conversation going in our healthcare system. And then you might recognize this from the presentation before, but Paula and the work that their colleagues in Winnipeg really are the ones that got me thinking about these motionless detector systems. This is the first system that I ever knew about. And so this is a hardware system. I like to distinguish between software and hardware. This is a hardware system, which means this is pieces of hardware that are all part of a clinic that aren't attached to the cloud or any kind of Wi-Fi service. And this is a check sheet that Colleen and I have been contributing to for many years. I think 2017 was when the first version of this came out. Colleen, do you remember interacting with this for the first time?
Yes, I do. It was fun, but also interesting to see the different things that needs to happen to make a bathroom safer.
Yeah, and we gathered all this information from other people that were doing this. Like a lot of information came from Winnipeg, AIDS Vancouver, came from folks in New York running a drop-in center, and we tried to organize this from minimal cost to moderate cost and maximum effort. And so this is on the list of resources that is shared with all the bathroom resources with the training here today. And some of the data, like we always haven't had concrete data to drive this, and this is something that you all can ask for from your coroner, but this isn't something that we got until around, I think 2017 was the first year that we got this data. So I don't have the 2017 and 18 years on here, but those numbers were highest. So that was like, I think around 27 or 23 in those two previous years of fatalities that happened in BC bathrooms. And the only reason why we got this data was because of a student working for Brave Technology issued a Freedom of Information Act to acquire this information, and so that we could all see it. So if you search for the BC coroner data and search for washroom, you will see this information. And you know what we can see is during COVID, when there was no bathrooms, there were no overdoses happening in bathrooms, and you can now see in 2022 that they're starting to creep up.
Well,
so this is really important for us. Yeah, go ahead, Colleen.
I was going to say overdoses were happening, but they're happening in porta potties and stuff like that, with where it increased kind of during COVID.
Yeah, and there were fatalities in those porta potties. Yeah. Well, we learned about other systems too in this historical time. So we showed you the hardware systems from Winnipeg, and then we have software systems like Brave Technology, which is a motionless detector, and then it alerts the front desk with a text message. There's another software system that I've just learned about. Brave, other than Brave, is Lifeguard Technology has a system called Light that is a button that goes directly to EHS. And so that's new. I don't know too much about it, but there's different ways that our emergency systems can be activated, either locally or to the greater system. And then lastly, a similar system to I think what Paula has, but something that's packaged and purchasable. It's an American system, I believe, from Boston. So this is the devices, the components to have either a sound or a light alarm system in your setting. But a big part of what Colleen and I want to share with you, it's more than safer bathrooms, right? We need safe spaces for people. So bathrooms is one piece of those. And Colleen, do you want to talk a little bit about this?
Yeah, so there is, like in Vancouver anyways, there's access to overdose prevention sites, supervised consumption sites, but we still know that people use in washrooms because it's just there's a lot of different reasons why people use in washrooms, but also a lot of times overdose prevention sites are like accessible for some people, especially for people that because they're very here in Vancouver anyways, they're very male dominated, so it can be tricky for females, and also for people that are gender neutral or non-binary and stuff, and so not everyone will go to overdose prevention site. They also can be really chaotic and loud, so people don't feel comfortable in that, so they find privacy in bathrooms where they can be alone and stuff, so it's tricky sometimes, but that's why substance use happens in bathrooms a lot of times. And
yeah. So even though that we have like the density that you can see here in the downtown east side, which is only one small area of Vancouver, people are still using drugs in bathrooms for privacy, and some people are injecting in their from artery, and that's really difficult to get privacy in an overdose prevention site. And then we have this other option, which is an episodic overdose prevention site. So it's a temporary place for people to use substances. You want to say more about this?
Yeah, so what we call EOPS is where you can set up anywhere. Like it's like you can set up an office desk. You can set up. A lot of times we do set up in like bathrooms, so it's someone could be a witness while they're consuming drugs, so that if they do overdose, we're able to respond quickly. And so you can set up EOPS anywhere, but it's just knowing where you are. And yeah, a lot of times EOPS is what we do for a lot of youth in Vancouver. It's easiest to.
Yeah, and so like in a clinic setting, say this could be what a patient room that's not being used, or an administrative side room that's not being used all the time. And so if somebody's coming to see their provider, they can come in and use in this room first, and then then sit in the waiting room and wait to see their doctor. What I really want to stress though, especially in a clinic setting, like a bathroom is not an episodic overdose prevention service. Like bathrooms need to be safe, and also we need to be providing people places to use their medication in a clean and sterile, or a better space other than a bathroom. So episodic overdose prevention sites, sometimes we say they're bathrooms, but in settings, especially medical settings, like we need to be really cognizant that we need to make the distinction between the two. Yeah, any last thoughts on that one?
Yeah, like we do mention that we do them in bathrooms often, but they can be anywhere. As long as you have a space like set up that's clean. Like a lot of times we carry newspaper with us to make sure that there's a clean space for someone to use on, and making sure that there's ways for people to get rid of their sharps and stuff like that.
Great, and this is new research that just came out that really just says everything that Colleen and I were just saying. Again, it's in your resources, but people will continue to use drugs outside of overdose prevention sites because they don't meet the need for safety and gender diversity, and for bottom line safety in different ways. So check this out when you have a chance. And just even have naloxone box saturation. So like in our housing settings, do we have naloxone on every floor that people can access without talking to staff? And in our clinic settings, this is a pilot project that we have in Vancouver Coastal Health. You can see in the top left corner, it's like the zoom in version of what's there on the wall. But yeah, having naloxone kits so people can come in and take a kit again and not even have to talk to staff. So it's just all of these ways that we can have more supplies and create safety that way. And then that leads us to the toolkit. So we're going to talk a little bit about this as soon as we do a little bit more trivia. But basically this toolkit came up from Maria Lugagnon, is a professor at UVic, and she initiated this idea of applying for a $15,000 grant to do knowledge translation of a lot of the work that Kali and I had been doing over the years and collecting, all the ideas from all across the country. And we worked with Trevor Goodyear, another PhD candidate at UVic, and Kali and I were the content experts, and then Hannah Leland is an architect who did the drawings for us, which is new for us. We've never had drawings of bathrooms to help us do this work. All right, so get out your phones or your computers, and we're gonna ask you a few more questions. What different methods of administration do people use to do drugs in bathrooms? So we have smoking, we have snorting, swallowing, injecting, rectal, and all the above. I know we kind of gave it to you, but I think we really wanted to share this because a lot of people really do just focus on injecting. Any other thoughts there, Kali?
People really do, and it's people use drugs in a variety of different ways in bathrooms, All
right. Everybody's pretty much saying the same thing. Great. Thank you for answering those questions. We're going to jump on to the next one. On average, we gave this away already, so we'll see who read our materials. On average, how many overdoses do BC Emergency Services respond to in bathrooms every month? Aha, people know. And we didn't have this research when we did this toolkit. We did it as a knowledge translation piece, and then as we were launching it, we asked BCEHS if they could share with us this information, and they did. And the average is what that spike is. So 50 is the average, but it ranged between 30 and 80 a month in BC washrooms. I am going back and forth between washrooms and bathrooms, and people would have heard that from Paula. We use washrooms in Canada, and bathrooms is more universal, and we're trying to switch our language to meet that need, even though our material was focused on BC, as that's where our grant came from. All right, I'll switch to the next slide. Where is the best place to mount a biohazard or sharps container? I also gave this away. Kali, do you have anything else you want to say about sharps containers?
Well, I guess what I have to say about sharps containers is the fact that having a sharp container in your bathroom doesn't mean that drug users are going to see it and think, oh, I can use drugs here. It's really important to notice that having a sharp container actually helps a lot of other people too, especially people like not just drug users, but help people that are have to take diabetics and stuff like that, and take insulin and stuff. They help it, so they don't have to carry their sharps with them and stuff. So it's really important that a lot of bathrooms have sharp containers because people need access to them, and it does not attract drug users. Like none of us are going and see the sharp container thinking, oh, we could use here, yay. It's not a thing that happens.
Yeah, and we need to have sharps containers that are also indestructible. Like, we need to have them at height where people can reach them. And You know, people are worried about children, and so am I. So we need to make sure, just like nobody can break into these containers and nobody can access Sharps containers. So it's those plastic Sharps containers that you see mounted on hospital walls or in clinics. Those are not for bathrooms. So it's going to be broken. The lip can be ripped out, and people can also take needles if they need to use, and they, you know, they're desperate. So this is a Sharps container I used in my bathrooms in San Francisco. You can't put your hand into that. And the Sharps container, I don't know if people noticed in Paula's pictures, was excellent also. And that's from ECS Cares, just super solid metal container. So yeah, it is about safety for everybody. That's our bottom line here. All right, next question. Do blue or dim lights stop people from using drugs in bathrooms? Kali, wanna say anything?
I'm not saying that blue lights are good. I'm just saying that blue lights, there was a study in the UK that showed that a lot of times what blue lights did is really taught people how to feel. Like, it is really dangerous to use with blue lights, but a lot of people were taught how to use through feeling and stuff. So that was an interesting study. But yeah, dim lights or blue lights are really dangerous for anybody that's using the washroom. Like, you can't really see anything, especially, and it's really, yeah, they're really bad to have it up because it's just, it's not stopping anyone from using drugs, and it's not stopping them from, but it does make it harder for people to use the bathroom, especially parents and stuff like that.
Yeah, I talked a lot about just like visually impaired folks or people at risk of falling, but yeah, it was, I think Shay brought it up, just people that are changing diapers. It's harder to change diapers in dimly lit bathrooms and blue lit bathrooms. So by targeting one population and stigmatizing one population of people, we really are causing harm across the board. So how do we actually just create safe, welcoming spaces for all? It's not to put blue lights and dim lights in your bathroom. And we've already answered this one for you too. So see if you're paying attention. Would people stop using drugs in public bathrooms if there were more overdose prevention sites? Anything, Kali, do you wanna?
It's true, like, even though we have, like in Vancouver, we have a lot of overdose prevention sites, people will still use in bathrooms. It's like, I'll say for myself, it's really, like, I use in bathrooms because it's private and I got alone time and then I have to share my drugs with anyone. So, and it was a place where I felt comfortable. And it's true that even though there's overdose prevention sites, people will still use in bathrooms.
Yeah, and there's a few people that don't know, and there might be other people out there too. And I just want to say, like, in some of, like, one of the fatalities that informed some of the work we did is in 2016 at the Sandy Hill Health Clinic in Ottawa, there was a fatality in their bathroom. And at the time, in the news article, when you read it, they thought that if they would have had their overdose prevention site, that fatality would not have happened in the bathroom. And that is possible, but also possible that fatality still would have happened. And so we need to have safer bathrooms, and we need to have overdose prevention sites, and we need to have, all the other things that create safe spaces and access to supplies.
Yeah. And like, I respond to a lot of overdoses in bathrooms still, and kind of like, yeah, people are still, like, even though we have overdose prevention sites, people are still using bathrooms.
Thanks, Colleen. All right, yeah, people saw this already. Yeah, door swinging in, door swinging out. Yeah. Okay, yeah. And, and it's a challenge, right? And that's, and somebody doesn't know. So let's just answer to that. So if the door is swinging out, then it's easier to access people. If it swings in and somebody falls against that door, then we can't necessarily get in, especially if the size of the bathroom is prohibitive. We can't sometimes open that door. We have to get a chainsaw to open that door. I've heard of a situation where fire tried to use a battering ram in a really small bathroom space. And if there wouldn't have been a staff intervention, like, that person behind that door would have been injured severely. So we have We have bathrooms that are just way too small, but even in the big bathrooms, we need these doors to swing out. Any last thoughts there? Nobody voted for David.
I know, poor guy. Yeah, like that. This is critical because it's like, if the door's swinging in and someone's against that door, it's like you have to call, like, paramedics will have to call firefighters in order to come and get the door down, because they it's challenging, and that delays a lot of time for that person getting oxygen or getting the lockdown. So it's really important that doors swing out, so that you're able to, and also staff have keys to that door, but also, yeah, it's just important to make sure that doors are in the proper way so that no one gets, so that there's not delayed time for when you're responding to the overdose.
Yes, all staff have keys to the door all the time. Yeah, all the ways to reduce the amount of time it takes. Okay, so list some ways that staff could be notified if a person has been in the bathroom for an extended period of time. We'll just give this a minute so we can, quick minute so we can get into our content again. Yeah, that's good. Some places have light detector systems that, the light could be on if people are moving, and it could turn off if they're not. Monitoring is the best if possible. Yeah, software, manual check-in, hardware. Oh, right. And even things like egg timers, right? It could be any kind of timing system, whatever works for your site, whatever you have funding for, start somewhere and evaluate it. Does it work? Do we forget about it? Is it foolproof? Like, what is the thing that's going to help us like support the work that we do so that we don't accidentally miss somebody? All right, I'm going to keep us moving along here. This is my last question. This is something I just added in. And which button option is best if the agency you work for decides to provide bathroom emergency buttons? I think what I really wanted to show here is that, like, yeah, there's a lot of different things that people could do, right? But really wanted to stress this 5 feet from the floor is not a great option. If you can't reach it, not a great idea. But people that have fallen need to be able to reach it. So close to the floor in some way. I like this idea of a string, and also, have you ever looked at that string? It's really gross. So as far as infection control goes, like, I've seen some really bloody strings on the wall in hospital settings. So I think trying to get away from that, maybe like a metal, like a metal chain would probably be a little better. It can clean better. Have you, Collie, what do you think? I see you smiling.
Yeah, so I was gonna say, the string can get really gross, and also the string could also be cut off and stuff like that too. It's like another thing that happens sometimes. And I've seen bloody. I've also seen really shitty strings. Sometimes they get really gross. But yeah, chain would work better, I think.
Yeah, and here's the no emergency button is effective for someone overdosing, and it rarely is. But having an emergency button in your bathroom, we've seen this in the New Fountain Shelter here in Vancouver. It's other people press the button for other people, right? So having a button at least helps get staff there quickly without having to run and look for staff. So it is a tool to consider.
And also, if you're alone in that bathroom and you need more help, and like you're responding to overdose in the bathroom, it's just yourself, and you can be able to call more staff that way too, a lot of times.
Yeah, you can hit the button. Yeah. Also having a cover on the button too, because I've also seen this where the emergency button is like with right near the toilet paper and then it gets hit all the time. And then there's a lot of false alarms. So really have good strategy around where you put that button. So if people need it, they can access it. Or like, who's it for? Is it for the person that's fallen on the floor, or is it for the person that's, you know, is it for the staff person or for someone that identifies someone who's in trouble? Okay, now to give you a high level view of what's in the toolkit. So we have a really great knowledge translation piece of a checklist here. I'm going to just show you the first page, but it's a lot more user friendly than the first one I showed you in our history. So this is just a screen grab of the PDF. It's a little bit blurry, but you can see it pulled up when you go to saferbathrooms.ca, and you can see it's a 3-page document, and it's really easy to use and lines to write on, so you and your team can go and evaluate your bathrooms. Do you like this one better, Collie, than the last one?
It's not as wordy.
No, yeah. Yeah, I mean, the last one, I could just keep making this font smaller and keep adding things, and we know that that doesn't really work very well.
Yeah.
And then we want you to make a plan, right? So we've got lots of ideas and we have lots of resources. So the resources in here are policy, we have signs, lots of scenarios, and we have the fact sheet. And I'll give you a screen grab of each of these things. But the policy and the protocol, again, big nod to Winnipeg. This was the first policy I've ever seen for safer bathrooms. And I've shared it with so many places. And I've known of places that have done safer bathroom work and have never had a policy. So it's like for 10 years, they've been doing safer bathroom work, but like, how are you training your staff and your new staff? And how are you making sure that people are doing the same thing all the time without a policy? And so we have one for you that you can adapt to your setting. And these diagrams, Collie, do you have anything that you like about these ones?
Yeah, they're really, I'm really happy that we got the architect to do these, because it really shows you like what a safer washroom or bathroom could look like. And it's, yeah, they're just really incredibly done and really highlight of like what we want for bathrooms usually. But I know it's not always possible, but it's also just, if people are designing buildings, like they can these and we use them.
Yeah, so whether you're doing a purpose-built bathroom or you're working on the bathroom that you have and you need to make some amendments, we have some diagrams for the single-use bathroom where the door swings out, and that's what this is. It's the preferable bathroom. We also have a diagram where the door swings in, and you'll see that the bathroom needs to be a lot bigger, the door swinging in. And the other space that I want to draw your attention to is that space right beside the toilet and the wall. We have a blocked area there. We want people to notice that we need to fill that space with something, because people fall into that space all the time. And if they're falling into that space, then we have to get them out of that space. And that means we have higher response times, and that's not okay. So we need to keep taking care of everyone by some of these things that we haven't been talking about. And that's a space that hasn't been talked about. So the least preferable one, door swings in, pretty much the same diagram. Next diagram is the multi-stall bathrooms. So you can look at these in more detail when you look at the website. And we just have a few examples of things for you just to see. This isn't extensive by any means, but just you need to be able to unlock the lock from the outside. Maybe see if it's being used, the red or the green. Collie, do you have anything about these? Any of these pictures that stand out for you?
The toilet paper dispenser, it's just like, it's really important to have ones that lock, because if not, they can get really gross if you just have them out on just rolls and stuff like that. So it's really, but else making sure that you're not able to really act like no one can stick anything in them too. It's really important.
Yeah, and also the top of that toilet paper shelf is a shelf, right? We like Paula actually has a shelf in the bathroom, which is ideal, and it's ideal if it's close to the toilet too. And that's why this shelf that's also a toilet dispenser roll is it's for anybody. You need to put your cell phone down, great. You need to put something down, anybody can put their things on top of this toilet dispenser. And you don't have to, then maybe if like you're working with a stigmatizing organization, you could just be like, it's to protect our toilet paper for everybody, but also we know that it's also a shelf. Yeah. All right, so some examples. This was a Colley's big addition to the signage, I think, right?
Yeah, I have fun making posters, but also just I'm like I've been in so many bathrooms. I remember not having sharp containers in bathrooms, and also people not knowing what to do with their sharps, and not like even if there was a sharps box, no one knew what to do with them because they still didn't. There was no signage, and so it's important to have signage about discarding used sharps, but also razors, land flips, and stuff like that.
Yeah, and then we have, if you have overdose prevention sites, let people know where they are. And a big thing about this is not everybody knows, right? Even if they're in your community and they're using substances, they might not know. So having this information and letting people know that there's oxygen available at an overdose prevention site might be the thing that that person needs to know in order to go use there instead of your bathroom. Like giving people information is taking care of people. And this is one of the signs that we really borrowed heavily from AIDS Vancouver, and they use this in their needle exchange. And I love that they put a heart on it. It's like, we need these to be nice signs. Yeah. And then lastly, just like some more information about that particular bathroom. I saw somebody was questioning like the 10-minute checks that Paula has. That is up to you and your organization, how often you think you need to check folks in your bathroom. But, as we know, people can overdose really quickly on fentanyl. And so chances are 10 minutes is too high. So that is just something that your team has to decide. Yeah. Do you have any other thoughts on that one, Colley?
Yeah, and I think it's just important that if you do have washrooms that's doing like, I know it seems like a lot of work for some people or businesses, but it's really important to do safety checks for washrooms for anybody. Like it's just important just to check on someone because you don't like people fall in washrooms a lot, but also you just never ever. Things happen in washrooms sometimes. It's just good to always do checks in bathrooms if someone's in there, especially if they've been in there for a while.
Yes. Yeah, exactly. And I just did one quick screen grab of one of the scenarios. So we have a scenario for you to practice, because you need to practice. For a drop-in center, we have one for a hospital, and we have one for a cafe. So just look at our scenarios and adapt them for your setting, and make a few, right? Make a few different kinds, and drill, right? So if you've thought about these things before, chances of you being able to respond instead of react, and then recover and have resilience is what we want for our staff and our colleagues. And then we want people to survive our agencies and the work that, the bathrooms that we're providing, we want them to be safe. Any thoughts, Colley, on that?
It's really, yeah, having these to practice is really great, especially for staff that are still like new, like are new to responding to overdoses or anything like that. They're just great to have that just to practice and just run drills. I know it seems like you're an army camp, but it's not really. It's just practicing so you can get used to these scenarios that can happen, and also just adjusting to, because we are in a toxic drug crisis in BC, and it's like we need to know how to, like, it's good to be able to respond to overdoses if they do happen, because they are happening.
And that's it. This is our last slide. Was there something big that you want people to know that you learned today that maybe they didn't notice? Just if you could share something so that we can see what landed for you, and things that are good for us to make sure we're teaching to, because yeah, what the feedback you give us really helps guide how we do this work. Great. Yeah, where to put things. What's the best place to put things on the wall? policy, resources, architecture. Yes. Yeah, Collie, your comment on ops being male dominated came through. Any last comments, Collie, before we get questions?
I think an important thing to know is that it doesn't matter how much you try and, like, as you probably noticed in our presentation, that drug use is going to happen in your bathroom no matter what. You cannot prevent someone from using in your bathroom. It's going to happen regardless. So it's really important to try and create creating it safer so that people are able to just be, I guess, not comfortable, but just so that if they do overdose, there's ways to respond to it quick and be able to respond to it quick, and that you are confident to respond to an overdose and stuff. So yeah, and just knowing that, I have to say again, like, sharp box do not attract drug users. It's not a thing where we see one and we're like, oh, we can use drugs here. It's really, Sharps container is just important for any washroom, the public washroom. And,
yeah, I see a Sharps container, and I think a place is doing that extra layer of safety and care for people that are using their space. That's what I see. So signal to the people that you're serving that you want to take care of them and you want them to use their bathrooms safely. And, you know, I think you'll have a better experience with your staff, and you'll have a better experience with the people that come to your facility. Thank you so much for coming today, and we look forward to hearing what came up for you in the chat.
Thank you so much, Collie and Shannon. We're actually going to take a bit of a break. Let's reconnect at 2:20. I'm Eastern Standard Time.
it would be,
so
it'd
I'd like
be
a 6-7 minute break.
So SBC 11:20.
Yeah, and so what we're going to do is actually have this small break. And this is an opportunity for participants to actually go and visit their washroom in their organization if you're at your workspace, to do a quick check to see if your bathrooms are actually, to invite you to vote in the poll. And you'll see down below in your Zoom that if you click on polls and quizzes, you will see it come up. And then we're going to have Shay share the poll results, and also just an opportunity to have a quick washroom break. And then when we come back, we'll get into the bulk of the question and answers. Okay, so I'll see everybody in about 5 minutes.
And then this is when we ask Naja and Jen to do their interpretive dance and maybe just create some small, like, light music. I'm just kidding. We're kidding. But for those of you who are here because perhaps you don't have a bathroom. Oh, Jen says that's silly. To see the poll, Samantha, who I think is from Wetaskiwin, you can look at the bottom of your screen. There's a little like surveys and poll button, and you can select it. Now, one of the things, let me just check. Guess what, friends? You don't have to worry about the poll. You have answered the poll. Well, or at least 104 of you have answered the poll. So don't fret. I'm pretty excited about sharing the content of the answers. And yeah, I'm pretty excited with 100% participation. Thanks. I'm going to be quiet now because now it's just being weird, which is pretty much my baseline. It's a feature, not a bug. See you in a bit, folks. Okay, now you're just validating the random chatting during the break. So what I will tell you is that I'm going to put the link into the chat, but we actually got a picture of a small person watching this video. And that small person is a puppy dog. So may not be the most like educational tweet we've ever sent out today. Thanks to Ryan for tweeting, by the way. It's looking great. I am going to find you the tweet. And actually, I might just share screen because willy-nilly, that's what we can do when, oh, there it is. All right, so I'm going to share screen and you can see, oops, the Twitter. Okay. There is the awesome Gidget in Grand Prairie who was helping her mom, Tracy, watch this video. It looks like on the couch. Shannon, we don't have enough dog pictures in our presentations. Life is so tricky, right?
Yeah, we need to do better. And cats.
And cats. And cats. See, here's the thing. You shouldn't actually encourage me because I work alone in my house in rural central Alberta. And this Waskesiu region does not have a lot of Shea coworkers on site. So I'll talk about anything, including the dog that's here making snuffly noises. Shannon, how are you doing? That was a great presentation. It was amazing.
Thanks. Yeah, we had fun. We have fun presenting together. Yeah.
There's so many questions and I'm just waiting for everybody to get back so that we can answer them. But I have to say, I want to thank you. I know that having conversations with you way back, like I want to say 2014, 15, 16, talking bathrooms, because we were trying to figure this stuff out was so helpful to me. And so I wanted to say thank you.
Great. Oh, that's great news.
Yeah.
And Paula, did you think I was going to be talking about you so much? Yeah.
No, I really appreciate that. Yeah, however, there are other, the field has progressed so much in terms of the technology and the approaches. So it's great to see that there are many options for folks to adopt. So because the bathroom configurations are so different, I think we need to be open to these different ways in which we could monitor bathrooms and make the spaces safe and comfortable for everyone. Yeah, it's great that there is that toolkit. I think helps a lot people who haven't thought through the issue, or at least put you in the right path to getting to crossing all the checking all the boxes around what makes a safer washroom safer.
Okay, everybody, welcome back from our little 5-minute break. I hope everybody had the chance to take a look at their organization's washroom. It's this presentation is really important because just in my experience, working at a community health center that housed as a safe injection site or a consumption treatment services, as we call it here in Ontario, it's really important because those bathrooms are another space that people have to use, especially if there's people waiting to use the safe injection site. And in my experience, if my memory serves correct, we actually did a 5-minute check on folks that were in the washroom just by knocking on the door and just keeping bathroom users informed of the protocols just around bathroom safety. So I'm going to invite Shay back to share the results from the poll. And then after the results are shared, we'll get into the larger Q&A questions.
All right, friends. So those first two questions, as you know, because we have 13 provinces and territories in Canada, you can't actually have them in one poll. So you have to ask two questions. So these percentages are not accurate. I want to say, Paula, you get bonus points for having the most Manitobans in this event ever. So good job to the lovely folks over there. It's nice to see such a range of genders. I know that helps lots of people know that they're not the only ones in the room. It looks like we're predominantly English speaking, but we have, I would say, one person who's unilingual in French who's asking me probably to talk slower, and other folks who are bilingual. We have a range of heritages and then lots of people from lots of different ways. So this is the second time we've ever had somebody from police and law enforcement attend. So it's nice to see them because they're also responding to bathrooms. And I'll hand that off. Thanks, everybody.
Awesome. Thank you, Shay. So I'm just going to present, just go in order of how these questions appear in the Q&A. And just jump in, panelists, if you want to answer. So the first question that we have is, I may have missed this, but is there an option for something like a one-lined phone that goes directly to places like NORS or something similar?
That'd be amazing.
You know, let me just say what NORS is for folks that don't know what that is. In Canada, we have phone apps for people to use. So there's the Brave app and there's a Lifeguard app, and people need smartphones to use these. But NORS is a phone line for access to someone to be on the other end of the line, a non-emergency person who can just be with you while you're using. And then if you have an overdose, they will then notify the emergency system for you. So yes, this is a great option. We didn't make that recommendation, but that is something we could add. So thanks for bringing that up.
I'll bring up about NORS too, is that you build, the great thing about them is they build a safety plan with them, so they don't call, if you don't want them, you don't need them to call paramedics right away. They can call, if you live in a building with staff, the staff can respond, or if you live in a building with someone, if you have a friend or something that you live with, they can respond to it too. So.
Thank you. Our next question, can specific safer door hardware, hinges, locks, etc., be shared? It's very hard to find all the options that are out there, even working in an architecture firm and asking hardware consultants.
I believe that's in a toolkit. We have some in toolkit. Do we, Shannon? I can't remember.
You know, honestly, like this, it's not a lot. I don't know. Most of them, like I just did some Google image searching to see like what locks are opening from the outside. So it isn't, there isn't a huge resource on this, and we need or other people need more funding to consolidate this and get more grants to have better information on this. Like even in the picture of the reversible hinges, I just took that picture from the Strathcona Library, which incidentally is the first library here in Vancouver to start with naloxone, which is amazing, and for all of you librarians to know. But yeah, the reversible hinges on those bathrooms in the libraries. I don't know if all bathrooms and libraries have those, if that's a standard, but these are things that questions that we need fleshed out, but don't have all the answers.
Do you have any recommendations for safer washrooms in spaces where there are no staff to monitor washrooms? For example, public transit washrooms or bathrooms?
difficult. I look at some of the public bathrooms we have available here in Vancouver, and I don't know. Like they have locks from the inside. They have yeah, really, like it would be really hard to get to people if there was this lock from the inside and you can't access from the outside, and people don't even know. They just walk away because the door is locked. So I haven't been engaged with city or parks on these kinds of questions, so I haven't done the work on it. Paula, Collie, do you?
I don't, like, the only thing I can think of is just like they're kind of funny, but I mean, you're kind of bad, but the public washrooms some of them that we have here are electronic, so that doors open up after like a certain time period, but those can be tricky too.
You. Our next question, this is around the episodic OPS. Do EOPSs need a federal exemption?
No, because we're not a fixed site. You're doing EOPS wherever you are, so it does not need a federal exemption, and you can do it anywhere. It's really just about witnessing and knowing a study about overdose training and stuff like that too.
Yeah, and you can find out more information on the link to we have ones for the BC CDC, the provincial organization, has recommendations for EOPS, and also Vancouver Coastal Health has information on EOPS. But yeah, they're just a space that is temporarily used. Like beyond your agency, nobody needs to know what's happening sometimes in one of your rooms.
I believe this next question was kind of covered in your presentation, but maybe we can just add more to it. Can you speak to anti-drug use bathrooms, like the blue purple light in bathrooms, and how is this so common?
It's I would say it's so common because people don't like people using drugs in their bathrooms. They think it's I don't know, people are just like, a lot of people still have the rhetoric of just like people shouldn't be using drugs, but it's like it's gonna happen. So people try and install things like blue lights, or like try and make sure there's no sharp containers, or trying to make sure that like but it creates a really big safety issue. Like people are shoving rigs in their toilet and stuff like that, and they get clogged. So a lot of times the anti-drug rhetoric is something we're hoping to change, but it's a big thing that still happens today, because people, and also like not letting someone in the bathroom because they look like a drug user is a big issue too. And it's like, you can't look like a drug user. No one. It's like it's challenging, but yeah, it happens.
Paula, do you have anything to add there?
No, I think that's, great answer.
You know, right when the toolkit came out, there was a CBC interview or in Ontario on the toolkit, and they were actually talking with a Tim Hortons out there who had just put blue lights in it, and at the time the blue lights were working for them. So there's this way of like creating stigma and creating unsafe spaces. People don't want to use your bathrooms, right? So yeah, you might not have people come and use your bathrooms if you are flagging that this is not a safe space for you. Do you want that kind of attention? Not everybody's going to get that, and then maybe you will still have a fatality in your bathroom. So
Right.
So I wouldn't take that as like it's going to just like deal with your problem population, and you're not going to have to deal with this issue anymore if you put some kind of stigmatizing device like this in your agency.
Our next question, this is around seating. Could there be a seat installed in the stalls? It's something that is found usually in handicapped showers. Is that a possibility to have that in for safer washrooms?
I think so. Like it is like, I think there, like, it could happen. Like you can.
certainly, if there is a space within the washroom to have additional features that will make the space safer and appropriate or adequate, why not?
Yeah, like just even like there's a film called Everywhere But Safe, and it's about New York and safer spaces, and they have a section there on their safer bathrooms, and they have a table in that bathroom. So if you have a chance to search that film out, but they have a table in that bathroom, and if you don't have a chair and you're standing at that table and you're using your substance and then you fall, then you could have a concussion. So yes, a chair would be great in those situations for folks. Yeah.
And just around the toolkit, is that offered in French? Because we do have some participants here that would love to share these ideas and protocols with our French-speaking folks. So is that possible?
It is possible. We just ran out of money with our grant. We just had $15,000 to make this toolkit, and our initial goal with Mary Lou was to do translation into multiple different languages of some components of it, and we weren't able to. So this is something that we're hoping to get some support with from Stimulus, and we will update you on the Stimulus website as we know anything.
What would be the worst possible bathroom design from a safety perspective?
I've been waiting for this question. Having a sharps container that's 5 feet, that's way too high, and also one that's like just a plastic hanging off of like the wire strip thingies on in a bathroom is really dangerous. But also just like having a toilet that has way too big of a gap on the sides of it or anything like that, and then having no space where you can put anything down. The toilet paper is on a roll and stuff, and just having it like so tiny where it's like you can get in there, but you can't really move around as much, and you can't put anything down because it's kind of, yeah, I would say that's the worst design that I've ever seen in a bathroom. And it really, like, you can't even, like, you can turn around in it, but you can't really put anything down. So it's just a bad design. And also just like there's a gap underneath the toilet too. And like if someone falls and then gets underneath there because it's like the weird gap there, it's like it really could be really dangerous. And so it's, yeah, that was the worst design I saw in a bathroom, and it was something I was like, oh, that's not helpful.
Paula?
I think that the swing door toward the inside when the washroom is too small, that has been something that, yeah, is common, and people will comment on that. Try to remember with some of the other features that our clients have mentioned, or people who participated in that study on safer consumption spaces that mentioned. But I think that was not be well lit. One of the interesting things that came out from that consultation was a bit of an ambivalence around having mirrors around. People will, some people, yeah, didn't want any mirrors around when they were consuming drugs in that space. So we'll try not to look at themselves that way. So it was an interesting conversation around that particular feature. Yeah, well lit, as clean as possible, well resourced. And I noticed that you have talked about having some supplies, especially naloxone, within those washrooms was good. So yeah, so I would think that the opposite of what we are talking about that will make it safer is, yeah, speak to the fact that some bathrooms are not safe or that don't have good features or good design.
I will mention that even
the last
like,
thing.
Oh.
Yeah, go ahead, Collie.
I was going to say, even just like even having tampons and pads in bathrooms is really a good idea too, because it's like they're like fucking tampons and pads are expensive, and like having like a lot of people don't have access to that, and it's like they're using toilet paper and stuff like that. So just put them in your fucking bathroom. It's not that difficult. And if your agency can afford that, but it's also just so that women don't have to worry about using toilet paper or anything like that. It's really important to have access to things like that and make it free.
Yeah, 100%. And what you said about the safer bathroom size, like new builds in Vancouver, like really trendy cafes are really tiny bathrooms. And I've showed my friends, I'm like, look, this door is swinging in. This bathroom is so small. You're a reasonably sized person. You would die in this bathroom if you fell against this door. Like, this is, building code needs to change in all of our provinces. This is unacceptable. And when you look at all the multi-stall bathrooms, wheelchair bathroom stalls swing out. Every single other one of them swing in. Like, check it out. It's crazy. We need to change that. If we have to change it within our agency, starting there, but we all need to advocate for building code to change, because that's what's causing harm.
Thank you. Our next question, how would we make portable toilets, porta potties, safe for drug use? We have a use for them as temporary bathrooms during shutdowns or branch renovations. So how can we make those porta potties safer?
They're not safe at all, because like for any drug use, because it's like, especially because porta potties are so tiny and they're really squished in, and it's like a lot of that, like when you're using it about like a porta potty, it's more likely you're going to get an infection or something like that, because it's just, there's such small spaces and there's fecal matter and stuff like that around. So it's really, I don't think we can make them safer. Like, it's tricky. It's tricky.
Holly, what are your thoughts on, like, when the city cut the 2 inches of space at the bottom so we could see people's feet?
That made it worse. That made it so much worse.
For
just responding to overdoses in them, and just like, because the door would get, like, it's just, they're awful, because the doors would get really stuck sometimes, and just like having that 2 feet of space, just I don't know, it felt,
it wasn't 2 feet, it was 2 inches.
Yeah, 2 inches. Yeah, no, it just wasn't, it wasn't possible to still respond to overdoses in them, and it just like that 2 inches was nothing. Yeah, like,
so yeah, even the little measures don't work. Yeah. You could have motionless detectors in there, right? Or for festivals, you could have people monitoring the bathrooms. Like, there have been deaths in porta potty bathrooms at festivals and things. Like, there is a need to have safer porta potty bathrooms. So having a brave button in those bathrooms and having signage so people know that it's there, but somebody would need to be able to respond to it. Like, you would need to have staff near those hubs, each individual hub of porta potties.
Yeah. And portable bathroom trailers are a lot better, because when you're using a porta potty, you're likely you're at high risk of getting infections and stuff like that.
Yeah.
Yeah.
Okay, so our next question, how can an organization help with the police discrimination associated with use? My province doesn't have safe consumption sites, and police discrimination is a big thing, and I help clients to navigate that. So any suggestions around that?
ACAP, but how can an organization help? It's hard, because like police are very like one-minded when it comes to drug use, and they're focused on the legal matter, and so it's really difficult to try and navigate police, like working with them and stuff like that. Like, I know for myself, working with police at an overdose prevention site is freaking difficult, because they assume that, like, and a lot of times they bring a lot of stigma when it comes to, so it's tricky, and it depends on your province too. It depends on the police force you're working with. The municipal or RCMP or like in the state, more difficult. So it's hard to say about that, but to navigate it, I would just say just being calm and just making sure that you have staff that are trained in respond, like talking to police and stuff like that, being able to talk to them in a calm manner and in a way that police kind of understand. It's great tool. It's a great thing to have, is having staff trained in police, because it's, if you just go to them right away and you start yelling at them, it does not help the situation at all. But yeah.
Paula, do you have any
Yeah, we have, because we are in public health, so we had over the years, our medical officers of health intervene with the police and bring forward some of the concerns that clients have brought forward. So we try to connect or keep some of those relationships alive. So whenever there are concerns regarding the ways in which police had addressed, drug use or engage with people who use drugs, we have a lifeline, so and are able to address some of the things. But there are many levels of policing, so we are more well connected with our city and police at that level. Yeah, but it requires a lot of education. I think the wake up call has been in the last few years with the increase of drug poisoning that they have to have to address. So that has been an opportunity also to think through what that means to police within that crisis. But yeah, it takes a long time and a lot of resources as well.
The last piggyback I would say from Paula is the education piece. I think it's just huge. Like even getting in front of those direct encounters in a situation, like my team of nurse educators has the opportunity to work with police and our CMP and do some education. And there's a lot of, there's a lot of stigma and there's a lot of, but from misinformation. And so having a safe place to learn is so key. So being able to create that space for folks so that they can treat people better is what we all need to do outside of really heated or like really challenging situations.
So our next question, I'm in a harm reduction group home for up to 6 at-risk youth ages 12 to 17. What would you say are the top considerations for safer bathrooms in that situation? Generally, fentanyl, meth, and gabapentin is used, limited cocaine, and lots of cannabis and cigarettes are being used.
I can probably answer this because I work with youth that use drugs, and it's one of my biggest passions and what I advocate and fight for. I think the biggest thing is just having someone there that's willing to do episodic overdose prevention, someone that's able to witness them using if needed, and just making sure that they know that they have people they can talk to, like not stigmatizing them, like being like, oh, you're a bad person for using drugs, like really being there for them and meeting them where they're at, not where you want them at. And so making sure that they feel comfortable and they feel safe to talk to you about drug use and just not shaming drug use. Like it's gonna happen no matter what. Use drugs, it's a big thing, and it's like we stop this whole thing where it's like stepping in and being like, you should go to treatment and stuff like that. Like wait till they're ready to go to treatment and stuff. So it's tricky, but it's also just something that we really need to remember. It's just like we can't have the savior complex when it comes to youth because it's really harmful. That we need to really understand that youth are going to use drugs. And yeah, so for safer washrooms, I think it's really important to have just like anywhere, but having EOPS and stuff like that, but also having I guess other things is just to make sure that you feel comfortable when they can talk to someone about this or to let people know that they're using and stuff.
Hey, this next question has to do with the Brave sensors and if and how they've been used in bathrooms. If we can share some successes or any lessons to the Brave sensors.
Well, just even like the very first one that I learned about and that they had in Vancouver was at the East Van Roasters. And East Van Roasters is a really small cafe, and the bathroom, you have to walk past the reception to go to the bathroom. And so for the most chance, there isn't a lot of random bathroom use happening, but you know, still like clients of the cafe could still be at risk, but they just weren't finding that it was happening all that often until it did. And that's why Brave is important. It's that soft scaffolding, not soft, it's that scaffolding that's there so that if you are busy and you're just don't have a chance to like check on the bathroom, or no other client is like opening the bathroom to use it and alerting you that there's someone in there, that you now have a text message to say like, yeah, someone's been in the bathroom for 5 minutes, you should check on them. So even when it's not a frequent thing, like this example of East Van Roasters was huge, but now we have Brave buttons going into a lot of our clinics. And we haven't, I don't have any direct examples, but also contacting Brave, they have lots of stories to share with you. They have a lot of places outside of Vancouver and BC. They've gone global.
Hey, so this next question, is there any more information on episodic overdose prevention sites? I would be interested in what the process would be to have this approved formally, or are these done on an informal basis? I'm in Ontario and we do not have an approved SCS in our community.
It's funny, they're used to having stuff on.
I just would like to add just something quickly, that this is, yeah, this particular town has had a very difficult buy-in from community around safe consumption sites. So I myself, I'm interested in the episodic overdose prevention sites as well. I do remember you mentioned that there is no federal, you don't have to require a federal exemption, but if you could just speak further to that.
Yeah, so how episodic overdose prevention works, it mainly how it's set up is so that you can do it anywhere, everywhere, where you are, as long as you have a safe space to do it and stuff like that. And so it's meant to, like, yeah, on the side of it, like an office desk or something like that. And it's really like you don't need approval for it. Like they're meant to be set up so you can witness someone using drugs anywhere. And like especially if someone smokes and stuff, right, you can stand outside with them and stuff. It's all about having someone there to witness your drug use, what it's mainly about. The BC CDC in BC has a really great resource on that. I can put that in link into the chat, but yeah, they're not, you don't really need approval. Like you don't even need to tell someone that you're doing it. Like if you are not comfortable with that, or you have staff that don't want to know about that, you can do it informally, like hidden away, or not hidden away, but just like on your desk. You don't really need to let people know that you're doing that. But it, yeah, it's meant to be set up so you can do it anywhere.
Yeah, I just put in the 3 links that were at the bottom of the poster that we shared, but that's also shared in the resources. But BCH as an organization, we're doing this now, and it's great that we're coming to this safer bathrooms and EOPS, but organizationally as a health organization, a regional health authority, like this is something that is being sanctioned, but it needs staffing, right? You can't just be like, here's an EOPS, like you really need to have someone that's responsible for that. And a front desk person might not have the capacity to do that off the side of their desk. So how is that being supported also with someone who has the skills and the knowledge to support that person?
And another thing is that, like, I do this a lot for use because you don't have access to a safe space to use and like consume drugs safely. So a lot of times we do this for use so they're able to be witnessed when they're using drugs, and also it just makes them feel comfortable. Especially, it's really important. I think a lot of times EOPS is really good with people lived experience. Like myself, as someone who's drugs, a lot of people feel comfortable asking me to witness them. So yeah.
All right, we have 2 more questions and then we'll wrap this up. The next question is, would you recommend including harm reduction supplies in bathrooms? We are going to be moving into a unit that has a bathroom, and we have plans to include condoms, hygiene products, sharps, etc., but are interested in thoughts on kits, making kits available as well. So safer use kits.
I'd say yes. it'd be a good idea. People don't like, they can just get it discreetly instead of having to ask for it.
I think definitely not bottleneck with staff. So anyway, you can have it not bottleneck with staff, like if it's in your bathroom or if it's in your front hallway, but the bathroom is private, so you don't have other people like watching you take supplies. So we want to have access. But I think it's a case by case scenario. I know some settings that might not work. So I think it's trying something and then evaluating it with your team and evaluating it with your clients and just figuring out how to meet the needs in a process driven way. Paula, would you?
Yeah, that has been a question that some of our community partners have asked, and again, yeah, this is what we suggest, to ask clients to see if that's something they might need, they want to use, and discuss that internally in the organization to see if that will work for them. In our case, we didn't, most people who come already into the space are people who are seeking harm reduction supplies. So it's not something that we even consider as people are comfortable asking for supplies. However, it's something that, yeah, could be or should be considered as part of the overall design and supplies that you want to incorporate there.
Our final question. Is there any way this panel will consider or will be presenting at any upcoming harm reduction conferences like Stimulus? Your views on safe drug use is very valuable. So is there any upcoming conferences that you folks will be attending in the near future?
You never know.
Nothing planned so far. Yeah, this was the big highlight of 2022. We haven't planned beyond this.
I'm just going to jump in and say, like, I know some people who plan some conferences. So please think about it, because the amount of response we've ever got, and just even the chat today, like there's so much need for more conversations. But think like you could install the perfect bathroom. Doesn't have to be a presentation. It can be art.
Oh my God, that'd be amazing.
Right.
I need to find some people that can build bathrooms now. Just kidding.
So we just had this last question come on, and I think maybe I'll just invite Shay back to answer this one. It's when and where is the next Stimulus conference?
So I can put some save the date art into the chat, although it's possible Jen or Naja have that close at hand as well. The next Stimulus conference is October 5th to 7th in Ottawa, Ontario. Naja is working really hard with our web tech folks to get that website up and running, and we're going despite the danger of the toxic drug supply and people traveling, despite COVID, despite monkeypox. We're doing it. We're going to figure it out. We have to figure it out, because there's no way to cancel this again. It's so important. So hopefully you'll be there. Definitely there will be scholarships. I know that was your next question. Also, we're looking for donors who will help fund the scholarship fund.
Thank you, Shay. So that's pretty much wrapping up for today. I'm just going to invite the our tech folks to come back on. I really appreciate everyone's engagement today and being a part of this valuable conversation and discussion around safer bathrooms and its importance in the ability to save lives. So at the end, we're going to actually invite you to fill out a 3-minute evaluation survey that will be put in the chat, I believe, or perhaps it'll be emailed out. And today's recording will go up on the Stimulus website soon. So I just want to thank all the speakers today. Thank you so much for sharing your valuable knowledge with us. And I'd like to hand this off over to Jen.
Thank you so much, Denise, and thank you so much to our panelists, Paula, Kali, and Shannon today. I'd also like to thank our wonderful translators, Danielle and Fanny from Co-op Largo, who do such an amazing job every single time. Thank you so much. My coworkers, Shay and Naja, who are in the background doing all the things all of the time. With that, I would just like to take a moment of silence, as it's just as important to honor, just as it's important to honor the land that we are on. We also want to dedicate our work to those we have loved and lost due to this toxic drug supply and the war on drugs. We rededicate our work to the ones we've loved and lost. So if we could just take 30 seconds to reflect on why we're all here today. All right, thank you so much, everyone. Thank you, Denise, for moderating. Thank you, Ryan, our coworker at CDPC, for live tweeting and also being part of Background Tech. Thank you, everyone, for joining us today. The chat was hopping. There's so much interest in this topic. And yeah, please watch our website, likely in January, for more info on the conference coming up. I would ask that the panelists stay on so we can have a quick check-in, and take care, everyone else. Have a good day.